Do you find yourself waking up 2, 3, or even more times a night just to pee? You are not alone. Studies consistently show that between 75 and 80% of adults over the age of 60 deal with this exact problem. It's what us sleep clinicians call nocturia. But here's the important part. Frequent nighttime urination is not just annoying, it disrupts your sleep, increasing your risk for falling at night and can have an effect on your heart health. The good news is that I have a solution for you. In this video, I will explain what causes frequent urination and walk you through my 6-step guide on how to stop waking up to pee once and for all. Hey everyone, I'm Dr. Michael Bruce, the Sleep Doctor. According to the International Continence Society, nocturia is waking up from sleep 1 or more times at night to urinate. I know what you're thinking. That's basically all of us, Dr. Bruce. And I get it. That definition does feel a bit broad. Here's how I like to look at it. I consider 1 episode per night to be completely normal if you're over the age of 55. However, 2 or more episodes per night, and the emphasis on more episodes per night, is where it gets clinically significant. Because studies show it's associated with poor sleep efficiency and increased daytime fatigue. In a 2025 study, the World Journal of Men's Health found patients with nocturia demonstrated significantly poor sleep quality scores compared to controls, and their deep restorative sleep was especially reduced. Our bodies are supposed to transition through 4 stages of sleep per night, but what happens with these frequent awakenings is you may never reach slow wave, non-REM, or REM sleep. Slow wave or deep sleep is responsible for the production of growth hormones, tissue repair, and something called synaptic plasticity, which in other words is our brain's ability to process and store information. REM sleep regulates mood, learning, and memory. You can fully understand the severity of what's at stake with these increased nighttime awakenings. One of the most common questions I get asked is, why does getting up to pee at night increase with age? Well, it turns out there are several factors at play here. One are bladder changes. The bladder's functional capacity declines with age. The European Urology Journal notes that both men and women experience reduced bladder compliance, leading to smaller urine volumes that triggers urgency more quickly. Number 2 are hormonal changes. Normally, our body releases an antidiuretic hormone called vasopressin, which reduces urine production. But studies show that older adults secrete less of this antidiuretic hormone during sleep, leading to higher nighttime urine volume. Number 3 is prostate enlargement in men. According to the American Urological Association, by age 60, about 50% of men have benign prostatic hyperplasia. By age 80, that rises to 90%. And an enlarged prostate obstructs the urethra, preventing complete bladder emptying. Number 4 are medical conditions and sleep disorders. This could be a huge factor. Conditions such as diabetes, heart failure, kidney disease, or sleep disorders, such as obstructive sleep apnea, insomnia, and restless leg syndrome, are all established causes. In fact, a 2018 meta-analysis in the Journal of Clinical Sleep Medicine found that people with untreated sleep apnea were 50% more likely to experience nocturia. And number 5 are medications. Diuretics, often prescribed for blood pressure or heart failure, are among the most common contributors. If taken late in the day, they shift liquid output to the night. You need to be talking all of this through with your doctor if you're not sure of the root cause of the problem. Now, before I get into my 6-step plan, I want to mention that if you're on Medicare, there's a good chance that you might be on the wrong plan and not even know it. I was talking to one of my older patients the other day, and he told me he switched his Medicare plan last year and has already saved over $1,000. And he did it using a free service called Chapter. And when I looked into it myself, I honestly wish I had known about it a lot sooner. Chapter advisors will make sure your doctors are covered, they explain every plan available in your area, and they even check to see if you qualify for extra benefits. They can compare all of your options in under about 20 minutes. So if you want a real unbiased help with Medicare, give Chapter a call at 912-809-3127. You'll actually talk to a real person who will help you figure out exactly which plan is right for you for free. All right, let's break down my step-by-step guide to stop waking up to pee. Step number 1, you must be limiting fluid intake 2 to 3 hours before bed. I know you've probably been told this 100 times, but there's no shortcuts on this one. If you're not adhering to this first step, there's really no point in moving to any of the other steps. A controlled trial in neurology and urodynamics showed a 30% reduction in nocturia episodes when patients reduced evening fluids. Now, in my last video on nocturia, I talked about my 3-2-1 method. That was where you stop alcohol 3 hours before bed, you stop food 2 hours before bed, and you stop liquids 1 hour before bed. This is a great general rule to follow, but specifically for you seniors watching, you really need to adjust that to a 3-2-2 method. If you take medications before bed, a small sip of water to help you with any pills is completely fine. One thing I do want to mention here about your daily hydration is that most of the water you drink every day should be front-loaded to before 4 p.m. This allows for proper absorption and time to eliminate before it can start disrupting your sleep. Doing this will also ensure you're hydrated enough, so that way you're not thirsty at all in the middle of the night. All right, on to step number 2. This is to reduce bladder irritants. 2 of the biggest culprits here are caffeine and alcohol. Both are diuretics, and study after study show even moderate evening consumption significantly increases urine volume at night. One irritant you're probably unaware of is snacking, especially closer to bedtime. You might be thinking, hey, Dr. B, snacks aren't liquids. Well, here's what's interesting. High carb or sugary snacks may cause a spike in blood sugar and insulin. If blood sugar runs high, the kidneys try to clear out the excess glucose by pulling water with it, which in turn creates more urine output. Pretty interesting, right? Step number 3 is to check your medication timing. The American Urological Association guidelines suggest that if you are on any diuretics, you should be taking them in the morning or early afternoon when possible. Step number 4 is to start bladder training. This comes in actually 2 parts. Part 1 is to practice what is called double voiding, or urinating twice within a short period of time. So what you're going to want to do is when you sit down to pee before bed, after your first urination, I recommend getting up and maybe walking around for just a couple of minutes. Then you try to pee again, which often allows the bladder to release any leftover urine. Why this might help is because some people do not actually fully empty their bladder on the first try. This is particularly common in men who have benign prostate hyperplasia. Part number 2 is to practice some simple pelvic floor therapy. I would recommend something easy like Kegel exercises before bed. To perform a Kegel, first, make sure you have an empty bladder. What you are going to do is tighten your pelvic floor muscles. Basically, just squeeze the muscles as if you're trying to stop the flow of urine or prevent passing gas for 3 to 5 seconds. After that, relax for 3 to 5 seconds. I would aim to repeat this roughly 10 times, and for the best results, I would aim to do 3 sets per day, not just 1 time at night. All right, step number 5 is to try elevating your legs or using something like compression socks. Fluid retention in the legs during the day is reabsorbed at night when lying down. In a study published in the Canadian Urological Association Journal, elevating the legs for 1 to 2 hours in the evening or using compression stockings has shown to reduce nocturia by nearly 1 episode per night in patients with peripheral edema. So those are my 5 main steps you need to follow if you want to stop waking up in the middle of the night to pee. Do not expect to do all of these steps for just 1 night and think that you're going to be cured. You need to make sure you have seriously committed for multiple days in order to see results. Now, what happens if you do not see progress from here? That's where step number 6 comes in. This is to address any possible sleep disorders or health issues with your doctor. I know how much you would love to solve this problem without having to go to the doctor, but if all else fails, it's very possible that you may need to address some other systemic issue. If you're experiencing any other symptoms of a sleep disorder, such as excessive snoring, tingling sensations in your legs, or waking up short of breath, it's probably time to consult your doctor. And if you have ruled out a sleep disorder, it could be something else undiagnosed, like some of the health issues I mentioned earlier. It would be good to speak with your doctor to potentially run blood work and a urinalysis to rule out any other possible conditions. All right, everyone, let me know in the comments if you found these steps helpful, and please remember to subscribe and like the channel. If you're interested in learning more about how to fall back to sleep in the middle of the night, or maybe the best night routine to follow as you age, go check out those videos right here. That's it for this one. I'm Dr. Michael Bruce, the Sleep Doctor, wishing you sweet dreams.